Modern medicine is failing in this country. I did a post on this, I don't know, less than a month ago, and it's gotten a lot of views. And the truth is, it's so sad, but we are failing in this country with medicine. Medicine is in such a bad place. We just are in this putting people in this reiterated pill mill of they come in, they complain of symptoms, and instead of us trying to figure out the root cause of the symptom or talking to people about lifestyle modifications, we're just here's a medicine, and they go and they take that medicine and it causes side effects, and they come back a few months later and they don't feel any better, and now they have more side effects, and so we treat those side effects with more medications, and it's just this continuous, people leave and they get more medications and they're really not getting better. And I've had a ton of people comment on this. It's almost gotten 1 million views. And a lot of people are saying, yeah, doctors don't want us to get better. If we get better, then doctors go out of business and there's not patients for them to see. Some of that is probably true, to be honest with you. Not necessarily with me. I would love for you to get better and not come back and see me. Not that I don't love you all, but I have hundreds of patients waiting to see me. I feel like it is true, and we need to figure out why it is like that in this country, and we need to figure out how to fix it. I think a lot of it is education. I told you guys this. We learn in med school and in residency that you treat patients with medications. You treat numbers, not necessarily symptoms. And you do it based on these algorithms, which all basically end up pointing back to medication instead of preventative care, and instead of trying to figure out what's actually causing the problem. It is very frustrating for patients I know. I was a patient myself. I was in that boat and in that hamster wheel for several years until I kind of figured out some stuff on my own. But I will tell you, it's frustrating for some physicians as well. So it's very frustrating for me. I know that I kind of take it almost personally whenever I can't figure out how to help a patient, although sometimes you give people advice or suggestions that they just think they can do or they don't want to do. But I do feel like in this country, we are in a really bad place where we are just giving people more and more medications, causing them to become possibly sicker with more side effects, instead of sitting down and really trying to figure out what is the root cause of these symptoms and these problems. And sometimes it may be something bad, sometimes it may not everything, but a lot of people need some therapy as well. But then they need to understand what is causing this. They need to understand how they can fix it, what is actually truthfully healthy, right? So there's so many things out there now about diet and about exercise, and it's what do you believe, what do you not believe? So that's just my kind of thoughts on this. It is really sad. It's the worst part about being a doctor, besides the fact that insurance companies try to tell me how to do my job. But I think the number one thing that is so frustrating is healthcare in this country, and it's that we don't work on preventative measures. We're very reactive, we're not proactive. So it is very frustrating, and it's something that I think needs to be fixed. It needs to be fixed with education and with people complaining and with people reaching out and saying, hey, we're not going to put up with this any longer. If you're a patient, I think find a provider that will listen and that will help you try to figure out the root cause of things. And that doesn't always mean that it's going to be a pill. Now that might mean it might be difficult. There might be some lifestyle changes involved in changing the way you're thinking, but I think that that's what we need to start looking for is root cause medicine, individualized medicine, and treating symptoms and people and not just numbers. If you like this information, make sure that you click the link to follow, like, subscribe, comment, tell me what you like, what you don't like, and I'll keep making this content.